Fibrosarcoma is a rare type of cancer that arises from the connective tissue, specifically the fibroblasts, which are responsible for creating the structural framework of the body. This disease primarily affects adults, though it can occur in children. It typically manifests in soft tissues, which include muscles, tendons, and fat, but can also arise in bone. Understanding fibrosarcoma begins with recognizing its origins. This malignant tumor can develop throughout the body, with common sites including the arms, legs, and trunk. It seems to occur more frequently in individuals aged 20 to 60 years, and certain factors, such as prior radiation exposure or underlying conditions like neurofibromatosis, may increase the risk of developing fibrosarcoma. Fibrosarcoma is categorized into several types, such as low-grade and high-grade fibrosarcoma, based on the differentiation of the cells. Low-grade fibrosarcoma typically grows slowly and is less likely to spread, while high-grade fibrosarcoma is more aggressive and can metastasize or spread to other parts of the body. The exact cause of fibrosarcoma remains unclear, but genetic mutations and environmental factors may play a significant role in its development. Symptoms often include a noticeable lump or swelling in the affected area, which may be tender or painful. Depending on the tumor's location, there might also be restricted movement in nearby joints or limbs. Diagnosis of fibrosarcoma involves a combination of imaging tests and biopsy. Physicians may use magnetic resonance imaging, or MRI, to visualize the tumor in detail. A computed tomography scan, or CT scan, can help identify if the cancer has spread to nearby structures. Ultimately, the definitive diagnosis comes from a biopsy, where a small sample of the tumor is removed and examined under a microscope for cancerous cells. Once diagnosed, staging of the cancer is crucial to determine the extent of the disease and formulate an appropriate treatment plan. Treatment options for fibrosarcoma depend on various factors, including the tumor's size, location, and grade, as well as the overall health of the patient. Surgical intervention is often the primary approach, where complete removal of the tumor and a margin of healthy tissue is attempted. This endeavor is crucial because even small remnants of cancer can lead to recurrence. In cases where the tumor is not operable due to its size or location, or if there is a high risk of recurrence, adjuvant therapies may be recommended. These treatments can involve radiation therapy, where high-energy rays are used to kill cancer cells, or chemotherapy, aimed at destroying cancer cells throughout the body. For some patients, targeted therapies or clinical trials involving new medications may offer promising alternatives, particularly for highly aggressive forms of fibrosarcoma. Supportive care and rehabilitation play significant roles in the recovery process post-treatment. This may involve physical therapy to regain strength and mobility. Regular follow-up appointments and imaging tests are essential to monitor for any signs of recurrence. Early detection of recurrence can dramatically influence treatment efficacy and outcomes. Living with a diagnosis of fibrosarcoma can be challenging, both physically and emotionally. Support groups and counseling services can provide invaluable assistance as patients navigate their diagnosis and treatment options. Awareness about fibrosarcoma and its symptoms is vital, as early identification can significantly impact survival rates. For those at risk or experiencing concerning symptoms, promoting open discussions with healthcare professionals can lead to early intervention, which can sometimes be life-saving. In summary, fibrosarcoma, though rare, is a significant health concern that requires prompt diagnosis and comprehensive treatment. With ongoing research and better treatment modalities, the outlook for patients diagnosed with fibrosarcoma and other soft tissue sarcomas continues to improve. It's important to stay informed and vigilant about health and well-being, fostering a proactive approach to potentially complex medical challenges. Thank you for joining us today to learn about fibrosarcoma.